Welcome, everybody. Thank you, first of all, for participating in our Leaders Who Care series. We've got really another international panel here, which I love. And let's just get started. I think the best way to get started would be to maybe if each of you tell a little bit about yourself, about your background, some really good personal information that no one knows about, stuff like that. And then we'll all get together and start chatting and getting into the good stuff. So ladies first, if I may. Sloane?
Of course, thank you for having us on the podcast. It's going to be great to talk with you today. A little bit about myself. I always hate this question. It puts you on the spot. I am a recent graduate from the MIT Sloane School of Management, which is where I met John. I work at Iterative Scopes as the VP of Clinical Operations. My background has really all been in public health or healthcare. And I have a brand new dog that we adopted during COVID. He's really cute. His name is Finn.
What's his name?
Finn.
Cool. They said that the dog shelters here are empty. I'm in LA, and they said that the reason they're empty is people who are single need companions, but they're also empty because married couple need a buffer so they don't kill each other. That's what the dogs are doing. So I don't know, which one are you?
Well, I've got a partner, and we found that the dog has been great because it's a question of who wants to take the dog out to pee and who wants to do the dishes, and now the dishes are getting done a lot more.
There you go. So see, you did good on the personal info. Okay, who's next?
I can jump in. My name is Bill Housworth. I'm a emergency room doctor from Louisville, Kentucky. But what I do mostly in my life is I run a hospital here in remote Cambodia called Chin La Children's Hospital. Really the background of myself is I'm married well. My wife is a med-peds physician as well, and she as well enjoys this type of work. So for more than 10 years now, we've lived and worked in Cambodia, initially at a hospital in Siem Reap, and now for the last 4 years, we built up a hospital in remote Cambodia, where some of the biggest health challenges remain. And it's a pleasure to be here this morning with you guys.
Got a good broadcasting voice there, man. Have you ever been told that?
I have been told that, yes, that deep voice.
And by the way, I've been to Paducah, Kentucky.
And of course, the standard joke is it works out well until they see my face. But anyway, yes.
I know the. All right, Jonathan, give us something.
Yeah, thanks, Mark, for having us on the podcast. It's very exciting to be here, and to have the whole panel. I think it's the first time that various parts of my life are coming together. And I don't think I've ever appeared in a publication or anything with Bill, despite having worked over a decade together at this point in time. So I just realized that when I invited him on the podcast, and I was like, Bill, I don't think we've ever published together or appeared together in public domain. Always in small meeting rooms, cafes, where we get comfortable. So myself, I'm from Singapore. I am a physician by training as well. I started my journey in healthcare actually in Cambodia. That was at Angkor Hospital for Children. That was about 15, 16 years ago now. Back when I was in high school. Back then, I think Cambodia was just emerging from the Khmer Rouge and trying to rebuild much of its medical system. And I decided that Singapore, being a very privileged society, could really do a bunch to help our neighboring country. I started a foundation with my friends and myself to rebuild some medical facilities. We started with the surgical operating theater at Angkor Hospital for Children, and then we moved on to building medical education programs, cardiothoracic surgery units. That was a good time, Bill. Neonatal wards. We also started one of Cambodia's first neonatal wards together. Pediatric burns and reconstructive units, and then I've never stopped supporting Bill. We've always been partners at work, and now we work together on Chin La Children's Hospital. During that period as well, I went through the military, and then medical school in Singapore, and most recently, about 3 years ago, I moved out here to the US to attend graduate school. So I attended MIT Sloane with Sloane, and also as a Fulbright scholar. And at the Kennedy, I was also at the Kennedy School at Harvard, pursuing my MPA as the healthcare policy fellow as well. So I've been given some tremendous opportunities in my life to explore healthcare as a very broad theme. And most recently, over the last 3 years, I've been leading a company. I've dropped out of school, both schools, to lead this company.
Tell us everything. We'll get to that. You tell us everything.
Don't show this to my parents.
You're like Robin Williams, where Jay Leno used to say, "Hi, Robin," and then Robin just took it from there. You're answering all my questions already.
Thanks.
No, so tell it. Did you, like Bill? Did you marry up also, or what?
I'm not married yet. I'm still a while away.
Do you have a dog?
I don't have a dog.
So let me ask you, since we went into that, let's start creating a little bit of a foundation yet. So you were pretty young, Jonathan, when you took on the challenge of children's healthcare, basically, and share with us how that happened and the results, and were you surprised?
Yeah, I mean, the first time that I started with a friend of mine from high school. So we were 15 and 16 back then. And the first time we said we wanted to help, we actually approached the director before Bill came in. His name is John Morgan. He's a really good friend of ours. And we went to John and said, "Hey, John, we really want to help you out here. We want to help. This hospital could use a bunch of help." The stuff we observed was, for example, there was no operating theater. The beds were metal frames. There was no mattresses, and it was all like rusting. And it was the only pediatric facility in a very wide distance. And we said we want to help. And he said, literally told us, "This is wall right here, and we need a mural painted on it." And we were like, I don't think that's gonna help. It might brighten some emotions, but I don't think that's what we're talking about here. I think we're young, but at the same time, there's a lot of energy, and we come from a country that's been very fortunate. So why don't we think bigger? And so that's how we got started. We had to convince him to allow us to help him, and he said, well, tell me more, right? Give me a plan and tell me more, and that's where we got started. It was quite an adventure and quite the start.
That's amazing, because it says what happens even in a lot of companies now, where people basically stereotype or categorize what they think you can do by how you look, right?
Yeah, they put you in a bucket, and it's so difficult to get out.
It's amazing. So Sloane, you've got education experiences all around women and health, I noticed, right? And correct me if I'm wrong. Planned Parenthood, Peace Corps, which I always wanted to do. So where did that come from? How did it impact and shape you as well, and in your work and your life in general?
Well, I think it's one of those things that's relatively easy to come across when you're a woman, and women's healthcare really is something that impacts me directly. But I think the first time that I really was interested in healthcare was as a kid. I actually grew up in Singapore for a while, and we had done some service trips over to Cambodia to an orphanage, and just seeing the impact that the lack of access to basic resources can have on people's progression in life, and being able to see really how much I was able to take for granted basic things like good dental care, access to preventative health care, et cetera, really put me down that path early on. I thought early on I might actually go to medical school, but I decided to pivot in my undergrad to public health. And so I started out with that public health degree. That was where I got my first exposure to Planned Parenthood through an internship there in college. I loved the organization. I had the chance to work there in the clinic, as well as actually as a health educator. Got to teach really interesting classes to people who were sort of diverse populations, women's detention centers, foster children, drug rehabilitation programs. And then after that, I went to the Peace Corps, where I was in Tanzania as a health extension volunteer. And that was, again, very eye-opening again, right? I'd had a lot of time in Southeast Asia, but I'd never been to the African continent. And of course, one country doesn't represent the whole continent, but it was interesting to see, again, the different disparities in access to care, different issues that impact quality access to care, both in terms of how the medical professionals there are deployed. It was really interesting to see that nurses and teachers in Tanzania are assigned basically to the communities they will serve, and it can actually have a detrimental impact on where quality care happens. If you have communities where you've got a nurse who's been assigned from one part of the country where there's a different dialect spoken, a different culture because the country is very big, and they're sent to one community, that can have an impact on how they're able to connect to that community, provide care to that community. And then of course the basics around, electricity, being able to refrigerate vaccinations, et cetera. I came back to the States, I was at Planned Parenthood again, and I actually was motivated to go to MIT Sloan because I wanted to do something with healthcare, startup, space, innovation, and that's where I quickly met John and stopped going to classes as much and started working on the startup a little bit more.
So Singapore, even though you were in Singapore, took all that time to finally meet him.
Yeah, it took about 15 years.
Wow. Well, I guess he was worth waiting for, right? Hey, Bill, Kentucky to Cambodia, what a culture shock. I would think in some ways, not a usual track that most people would take, but definitely pretty admirable. And like I said, I've actually been to Paducah and Louisville myself, and from Montreal, and that even was a culture shock. Share how that all happened.
Early in our careers, we before we had children, we worked overseas. We worked at various faith-based and non-faith-based organizations in Africa as physicians. So we'd run feeding centers or work in mission hospitals, this type of thing. And we would have similar experiences where we got to know the local healthcare workers, the healthcare situation, and we began to look at the bigger picture. Fairly quickly, we realized that our utility as physicians in and of itself wasn't going to be that great. So I'd fly home, I'd work in the ER, that's how I made a living in Kentucky. But then we decided that a wiser step would be to get a graduate degree in public health is what we chose. And so we applied, we got into the Harvard School of Public Health, and we spent a year there. And from there, it was a stepping stone to be able to do bigger work, system building work. And we had the invitation to be the director of the hospital in Siem Reap, and lo and behold, we took it. My standard joke about the Harvard School of Public Health is it is the only school at Harvard where you're guaranteed to make less money when you come out than you went in, and sure enough, that's what we've done successfully for the last 12 years. But it's been very rewarding to do that. And what we do is something that we count as a huge blessing and opportunity in our life to make a difference and to try to build up in a systematic way. It's not just Band-Aid work we do, but working with people like Jonathan over the years, what we've done together is a systems approach at building things up, finding the real small problems. In one case, he mentions neonates, but then finding the systematic solution to the neonatal deaths together. That's been fun, rewarding work over time. And I still fly home to Kentucky. That's how I make my money. And so I enjoy Kentucky to this day.
No, Kentucky's cool. It's funny, when I moved down to the States, I took this job, executive director of a global nonprofit. And I always joke around saying it's the best job I ever had for the least amount of money I ever made. So
exactly.
So Jonathan, share with us the vision, the hope, the impact you expect to happen from Iterative Scopes.
Yeah, so just to give you a little bit of background as to why I decided that Iterative Scopes was a good idea. It's frankly a combination of my past experiences. In Cambodia, I had the opportunity in Cambodia to participate in a very real way in trying to build up a medical education system. And then I also had the opportunity back in 2013 to come out here to Boston to train at Mass General as well as Children's Hospital. And the disparity is huge. Not only is it huge, but it's widening. My perspective was that there was so much dollars, so much brains congregating around systems out here in the best hospital systems, be it Mayo Clinic, MGH, and the such. But very little was being done beyond conferences and journals. Very little was being done to move that knowledge across barriers. And so I found that surgeons in Cambodia, for example, when we were creating pediatric cardiothoracic surgery units, which is one of the most complex surgeries around, we found them even like using anatomy textbooks on the table next to the surgical table. Bill smiling because I think I was there and he was there right next to me when we realized that we were looking from the outside, and we were like, I was like, is that Netter's textbook? That's the stuff what? That's the stuff I used in year one, and we know it doesn't translate like that. And I said there must be a better way to move knowledge. There must be a better way to convey knowledge, not just across borders, but even barriers, like between here and Kentucky, between here and rural Tennessee. There are barriers that exist, be it visible or invisible, that create healthcare disparities. And my mission here is to really examine how, if possible, we can best capture what we call today intuition in healthcare, put it into a box, and gain the ability to send it anywhere in the world that needs it. That's I guess the overarching vision for the company, and really what I hope to achieve here.
No, that's super cool. And Sloane, what turns you on? What gets you most excited about Iterative Scopes?
Oh, well, I think John hit the nail on the head there. The idea of being able to leverage this wonderful time we live in, where we have access to more technology than we ever have before. We have a lot of interest and impetus behind the idea of AI in healthcare, and being able to take the insights and knowledge of some of the most well-trained, well-resourced folks in the world, and expand that to both generalists in the United States and abroad. Again, there's a stat that people like to quote here in Massachusetts about how in Boston, the quality of life and length of years of life that you expect to live is 30 years more than just boundaries outside of Boston. You have to leave the state. It's amazing to think about how much you can improve care if you just really diffuse those resources and that knowledge. The long-term goal of getting stuff into the hands of the most vulnerable populations is really the thing that's exciting. In the short term, getting to interface with really brilliant folks who are trying to solve gaps, and that's where I spend my days, talking to folks who are trying to figure out how do we improve these disparities or disagreements between folks who think one feature looks one way and another thinks it looks another way, and the impact that has on patient outcomes. That's really exciting to me.
Yeah, it's amazing. And Bill, you mentioned before when we were talking about how they handled COVID really well in Cambodia. And I've talked to so many people that say, because of while you're talking about the disparities, that one of the problems was we didn't handle all the pandemics before COVID, that so many people died because their immune system, et cetera, I'm obviously not a doctor, was not good enough, and because of the disparities, which is a shame and an understatement. Bill, what kind of connection is there? I know there's a connection between you and Jonathan from a health perspective between Iterative Scopes and Chandler Children's Healthcare overall, or in some ways?
Jonathan and I are connected because health disparities is really what we're about. I mean, both his new company, but also his continued work with us. His mind and his passion focuses on how do you look at the future of healthcare? How do you address these challenges intelligently? How do you not try to recreate the past and fix the problem, but how do you look to the future and the future solutions and new models and new ways of doing that? And it's a mental connection we have about our focus in life that I think is the overlap between the Iterative Scopes and Chenla. I know Jonathan very well over the last 12 years, and I know where his passions lay. And his passions genuinely lay in trying to overcome disparities. I've never seen anybody work so hard at that in my life, actually.
Super cool. I'm gonna cut it here a little bit because my computer flipped and I actually missed the middle 3 questions. We're gonna edit it in the middle, so I'm gonna start now and we'll edit it. So Jonathan, from Singapore, you've talked a little bit about this, where you had multidiscipline medical experience. Like you said, you went to MIT, Harvard, got your MBA, MPA. What really motivated that decision, and how did it lead you then to founding Iterative Scopes?
So, this was about 4 or 5 years ago. And we were making, we were rethinking how we wanted to deliver healthcare in Cambodia, and really Bill, I'm sure you remember this again. We met up in Myanmar, and we were just hanging out and getting some drinks, and we were thinking about what the various models that were out there to deliver care and to deliver education into these systems. And the one thing that struck me was that whatever we chose to do, it would be inadequate. It would be terribly inadequate. And there wasn't a way I could think around it. There wasn't an operational way of thinking around it. So I said I have to rethink it. I have to start questioning the basis of it, right? The basis of which we educate, the basis of which we transfer knowledge. And it frankly drove me in quite a spin, where I was like, I guess one of those problems I can't get my head around. And so I said, I'm going to pull my head out of clinical practice, and I'm going to, I used to be a surgical trainee, and I'm going to spend some time rethinking how we are approaching healthcare and approaching medicine, right? And I said, and I had this huge opportunity. I was given a Fulbright scholarship and a whole bunch of support to attend grad school, amongst which Harvard gave me a couple of fellowships and all. And I said, where better to rethink all this, and where better to resource myself than at MIT and at Harvard. And so the network and media, has really enabled the broadening of the mindscape I have, and I'm terribly thankful for all the support that has been given and opportunity that's been given over the years. And so I think that's how I landed at it. I said, in order to close this disparity in a very much more impactful way, where we're going to move the whole needle and make it much more sustainable, long after Bill and myself and Sloane are gone, how do we make it last? And that's the question the enduring question I'm trying to answer here.
And so Sloane, you kind of talked about this a little bit, how you connected with Jonathan, but kind of like him, there was different ways you could have gone also, and whatnot. What attracted you?
MIT does a really great job of making sure that anyone who has an idea can possibly get a small amount of money to sort of fund that idea. And when I started school there, I actually had an idea about something to do with women's reproductive health care. I had some sandbox funding from MIT. I was working on it. But then I met John, and he was so passionate. I was at a dinner party with him. He was so passionate about this idea of automated detection of polyps during colonoscopy. And I remember, like, he was washing dishes, and he's like mimicking the process of like performing a scope. And I just was like, wow, this is someone who I've got to listen to a little bit more, right? And over time, those first couple of weeks out on campus, we just constantly were running into each other, talking about things that were compelling to me. He's clearly a person who does stuff. Almost everybody who goes to MIT Sloan has an idea, and they want to sort of explore it a little bit while they're in school, and have an easy space to actually safely experiment. But John had actually done stuff, and within the first couple of weeks being at school, he had sort of sourced some advisors, like some of the top minds at MIT Computer Science Artificial Intelligence Lab. He was talking with potential investors. He was actually getting stuff done. And I was like, I want to see how this person works, and I want to work closely with him. So the idea was compelling, but also just seeing that he could get stuff done was really exciting.
Take this as a compliment, but you kind of reminded me of the Big Bang Theory there a little bit. Not the actual theory, but the TV show. And take that as a compliment.
I do. I love the show.
So it was interesting. So Bill, did you meet Jonathan when you were at Angkor Hospital? I can't remember if you mentioned it or not. And tell us about the impact that's being made in Cambodia.
Look, I met him, I guess, 12 years ago at this point. And the way I would describe John and working with John is he's tenacious. Once he sees a problem, and once he's going to solve that problem, overcome that problem, he and his team and the people that he motivates around him get it done. It's always hard for me to reflect on everything that John and I did together in the past in Cambodia, whether it was neonatal, whether it was education, and certainly the biggest thing we did together is that we actually built up an open heart surgery program. And the story that I always tell as an example is that to raise funds and raise awareness of that in Singapore, Jonathan and his team literally took apart a Cambodian house, put it on a boat, sent it to Singapore, and reassembled it in the Arts House in Singapore for a fundraiser.
Wow.
That in and of itself tells you who Jonathan is. It was a crazy idea, impossible, not a good idea, would never work, and it worked brilliantly. It's and the impact of what Jonathan has done and his team has done in Cambodia to this day lives on, both in skill, knowledge, and the units that they build. I mean, it's just impacting thousands and thousands of kids' lives. So it's been a pleasure over the years to work with them.
Yeah, I figured I couldn't bring enough people to Cambodia, so I'd bring Cambodia to Singapore at that point. and it wasn't someone's house, so we had it built. I didn't take someone's house and just pull it apart.
You could kind of be the minister of immigration or something, I guess, or something to that effect. No, it's amazing. Who was it that said it's only impossible until you make it possible? So somebody had said that. It's and sometimes it's better not to know than to know, type of thing, because then you do stuff. Hey, let me ask you all. My grandparents were from Kiev, Russia, and they would always say, they came with my mom and my aunt to Canada and grew up, and they would always say in their accent, as long as you have your health, that's the most important thing. And then they would say, and then education. And being involved in somewhat in branding and things of that too, that was not a brand, that wasn't a slogan. They really meant it from deep down based on all they went through, right? And you see it. I just want to ask you, with respect to all that's going on now, you have COVID, you got wildfires in California, you got racial injustice, it was going to hit a tipping point, why not now? And everything's going on. Mother Nature is having a blast because she's not happy. Do you see everywhere you are in your lives, for lack of a better word, some kind of awakening of what's important out there? And go back to Sloane.
Yeah, I mean, I think you see that definitely. The values that you have during a time like this, I think really are reflective of who you are, right? I mean, what you're choosing to put your time and effort into. And it can be tempting to want to put your head in the sand, honestly, when there's so much happening. But being able to have, like, for me, speaking for myself, having a really strong support network. I'm really grateful to have family that, I have a strong relationship with. My partner is fantastic. The dog is great for pets, but also having a really strong collegial workforce that I am able to go into the office, remotely through Zoom every day and actually feel like we're working on something exciting and compelling. It makes it so that, I feel like I am doing something valuable there. I won't lie. There have been times when I've thought I need to quit Iterative Scopes and go and actually, make a difference. I need to go be protesting something and making it clear that we're not, what we're doing is unacceptable. But at the end of the day, I think what I am doing right now does have direct impact, and it makes it easier to get through these sort of chaotic times.
So you're not thinking of rejoining the Peace Corps or anything, right?
Not right now. I think they actually have pulled all the volunteers from all the countries in the world. It's the first time they've ever done that. So it would be a while before they'd be able to deploy me again.
No, that's cool. And Bill, what do you think?
I think the people that are making it through these times the best are the people who focus on just being thankful. There's an old Christian mystic from 1300, a gentleman named Meister Eckhart. I think they locked him up in jail for being a bit of a Christian mystic, but he said, if the only prayer you ever said in your entire life was thank you, that would be enough. And I think that when you look at these times, the people who are able to remember to be thankful for what they have, for the health, as you mentioned, if the health is the only thing you have, then if your health is good, then you have what you need, and to be thankful for that. Those are the people who are making the best through these times. Not everybody's doing it, but I do believe over time, that's what people will come back to. We live longer. In the year 2020, we as human beings live longer. We have more educational opportunities. We are doing better, even here in remote Cambodia, than we have in the past. So we have a lot to be thankful for, even amongst the chaos.
Amen. Beat that one, Jonathan.
Yeah, I am certainly thankful that for everything we've had so far. But for me, this pandemic has been, it has been illuminating even, and maybe even really want to focus more on healthcare disparity, really because we're seeing, this is even highlighted even more that we are only as good as, the weakest, the weakest part of the weakest link we have, the poorest folks we have, and really the folks with the worst healthcare outcome, right? So, I mean, just to give you an example, I come from Singapore, right? And early in the pandemic, everyone was like, yeah, Singapore's doing a great job. We're doing fantastic, and really we were, until we forgot our weakest link. We forgot our migrant workers, and there was a pandemic amongst our migrant workers, and we struggled to get that under control. And that was because we were not focused on the healthcare disparity. We were not focused on their living conditions. We were not focused on the parts of society which really needed our help the most, right? And we are guilty of that. We're guilty of that too, many times over across the world, right? And it's played out again, again and again throughout society here, where we are seeing disproportionate impact throughout various parts of the U.S. where personally, I always reflect on this. I said, I think I have many friends, but personally, I am, number one, I don't even not have friends who have not passed away, but out of the hundreds of people, thousands of people who have passed away, I don't even have anyone who has gotten sick from COVID. And that's insane, right? And that it's a non-trivial number that's gotten sick in the US before. And like, we really need to take care of the most vulnerable here, and we really need to invest in these tools that are going to help us close the gap. Otherwise, we will pay the price for it in the long run, be it through be it through this disparity in healthcare outcome, but in less obvious terms, in social unrest, in the inability in the separation of ideologies that we are seeing today in the U.S. That is just so evident in terms of our disparities throughout society that are being magnified. Even I think this pandemic is magnifying this problem.
Yeah, no, it's well said, and you kind of started answering maybe the last question I have for all of you is what role do you see business leaders who care? Because a lot of people see that it is really up to the business leaders, whether it's about healthcare or peace or whatnot, to make a difference. What role do you see business leaders who care have to play with respect to, I call it the three well-beings: financial well-being, physical well-being, and mental well-being, which can include spiritual. And as you all know, mental's big time right now. With respect to not only their talent, their employees, to be able to keep them and develop them, but how that flows into the community. I'll go to Bill this time first.
One of the things that people know me, what I always say is that leadership matters, and business leaders are leading their troops. The primary thing that people spend time on is their work and their job and what they go and do each day. And they're looking to their leaders for their moral values, for their work values. They may not say that. They may, I think people do from their own communities and from their churches and from their synagogues and from their faith communities and from their own internal families. They get a lot of values. The truth is, we interact with our work colleagues more in the modern world than we do with some of our family members oftentimes. And the influence that business leaders have on those workers is astronomical. And so people do look to the business leaders for guidance of how to navigate these difficult times. And we look to see, how are they behaving? Are they taking for themselves? Are they thinking about common good? Is there a common good in their corporation or business? Or is it really just about only making money? And people internalize that on a daily basis when they go to work. For what we do in Cambodia and working with Jonathan over the years and all the different partners that we have doing this, what I realized is that business leaders want to make a difference. Even people who are in businesses that may not have a social impact per se themselves, they want to be involved in helping the common good. Right. And as you mentioned, one of the biggest common goods is our health. We all want to be healthy enough to love our families and to take part in society. And if you have that, it's good. And certainly I've been very thankful for the business leaders we've worked with over the years, including Jonathan and his team, for what we've been able to do. And what they bring to something like a do-gooder like myself is efficiency and smartness and oversight that is much needed in the sector that I work in.
So who are you on the Big Bang Theory as a do-gooder? No, that's I really appreciate you saying that, because it's so important. And Sloane, if you can add to that in your opinion, and also how that ends up even going to the dinner table when everybody goes home.
Yeah, no, I think it's like Bill said, at the end of the day, we do spend most of our time at work, right? And so what we're hearing and espousing at work does carry into our personal lives. When you think about the ability for a workforce to be led by leaders who are saying, we're not going to compromise on certain principles, be it where we're going to make sure that because we can, we're not going to force you to come into the office in a pandemic, right? We're going to be flexible and smart and intelligent and ensure that you feel safe, because we want to do our part. So, when Boston opened, we decided to not necessarily roll out exactly, even though the phase 2 said we could. We were very, very, very sensitive about that. Additionally, even though we aren't an organization that is focused on racial justice directly, we do have a diverse employee population, and we had the opportunity for people to hold forum and discuss how people were feeling about the protests and about the racial inequity. And we are really fortunate to have employees who stepped up to educate each other on some of the different challenges that people of different races face in this country. And I think it's great that I'm really glad that we've been able to create that kind of environment. And I think it's great that there are many people in different organizations that are trying to do that, right? To ensure that people can disassociate themselves from who they are when they go into the workforce, and to hopefully having the workforce environment be one that helps people to grow and evolve. And then when they go home, like you were saying, back to their dinner tables, bring that information with them, right? I think I've learned so much, not just again about some of the issues we've discussed today, but really the broad variety of intersections of life that people have, and the different mental wellness, the challenges of having sick family members, et cetera, all of that now informs how I treat others in the rest of my life. And this has come through having open conversations and that environment for discussion with my colleagues at work. And I think it all comes down to leadership of transparency, humanity coming first, right? And that it's hard to not have humanity come first when you're at a company where you're focused on improving the impact of patient outcomes, and that really is a human-centered approach that we take.
No, that's brilliant. Just to kind of conclude, Jonathan, to add on that too, but also with respect to, I had someone tell me, when they were younger, and their father was a good person and whatnot, but he'd come home and his wife get him a drink, the old style, and he'd sit down on the couch. And a lot of times for people now too, but when he goes home, he works at a really good company, and he sits with his kids, and they're excited to hear what he did that day. They're excited to hear, how they made a difference, or what they even did in their business. And it gets down to the kids to then see that, wow, that's how it is, right? That's great. Better than, oh, I hate my job, my boss sucks, that I'm tired, and all that. Kind of complete the thought here with your perspective of that.
Yeah, I mean, so there are two parts to it, right? And this is particularly why I think I'll never leave healthcare, is because, I say this again and again, in healthcare, if you really want to help people, if you really, really want to help people, all you have to do is do a good job. It's so naturally aligned, right? You just naturally end up helping people. Sure. And that's why I love it. And I get to meet along the way, I get to meet people who similarly want to help other people who are naturally aligned. I don't have to look for a niche segment of people that are like, maybe this guy want to help somebody. No, it's if you're working here, it's much more likely than not that you are aligned. And I have this firm belief that you really are, and you become the people that you're closest to, right? You are. It's daily influence. And so I'm thoroughly thankful to have people like Bill, like Sloane every day, not just hold me to remind me of why I'm here and what I've been trying to do, but really to be able to speak frankly, right? I've had days where Sloane has called me up, Bill has called me up, and be like, "Yo, this is what I truly think about this. It's like are you home? Are you thinking about this?" It's such a privilege, right? It's such a privilege to have people who have been able to who have people around who feel empowered enough to do that for me, right? And that's what in return I hope that I every day deliver back to my colleagues, my coworkers, my employees. Sorry, I live next to MGH, so.
After the election or something, who knows?
Yeah. But like every day, I try to reciprocate that in our company, and I think just being able to have that privilege of someone, remind you of why you're doing and what you're actually trying to do. That is invaluable, right, to change someone's life.
Yeah, no, I really appreciate what you guys do, and I really appreciate you coming on, because it's pretty inspiring, how much you do care, and that's what this is all about. Care is not one of those your vulnerable skills anymore. It's a real needed skill that people are realizing, and so I thank you guys for all that you're doing, and for sharing it on this series, and look forward to speaking to you a lot more.
Yeah, thank you. Thanks, Mark. Thanks for having us.
Thank you very much.
It was a really fun conversation, and fun to hear Bill and John, your perspectives on some of these questions. You did a good job crafting some insightful questions, Mark.
Well, thank you. A question mark. I love when someone says that, question mark. No, appreciate it.